Welcome to the episode 8 of Gotham Acupuncture Podcast. I'm your host, Joshua Garcia, and as always, I'm with Dr. Peter Karen. So, whether you're a regular or tuning in for the first time, we've got a great episode lined up for you today. Dr. Karen, it's great to have you here again.
Oh, great to see you again, Josh. Always happy to talk.
Thank you. So, let's jump right in. Dr. Karen, when you have patients with multiple health issues or complex medical histories, how do you tailor your acupuncture treatments to meet their needs?
Sure. So often patients come in with a very simple problem like I have headache or I'm having trouble sleeping or I have a digestive issue. But you're right, some patients come in and they say, I have headaches, digestive issues, and problems sleeping at the same time. So how do we think about these things? Chinese medicine has wonderful tools for figuring out the order in which to approach these issues. Sometimes within our diagnostic system, all of these different things are coming from the same place. The language we use is all of these branches are coming from the same root. And so if we resolve the root, then all of the branches can be resolved at the same time. Sometimes people come in with multiple roots, each of which is creating branches. So we have different ways to think about how to approach this. My primary training comes from what we call an earth school approach, which is I first focus on making sure that my patients can sleep, that they're producing resources, which means that their digestion is working well, and that they're excreting waste, which means that they're pooping. As long as they do those three things, then we can use the resources that they're producing to treat other problems that are arising. So that's basically my approach. I often refer to this with students as get your patients rich before you spend their money. So if a patient is anemic, but they're also depressed, I want to treat the anemia first, get them to produce more blood, and then we can go use some of the resources they've produced to resolve the underlying issues. That's the process.
I see. Now, what are the most common barriers to trying acupuncture that you hear from patients, and how do you help them overcome these concerns?
Sure. And some people don't like needles. I mean, a lot of us have had experiences as
Yeah,
children or even as adults of having very painful interactions with medical professionals who are using needles. Acupuncture needles are very different from hypodermic needles. The acupuncture needles I use, we can fit about 20 of them in the hole in a hypodermic needle. So, what we're talking about is an order of magnitude smaller. For patients who are really nervous about the needles or who are very anxious about the pins hurting, I'll often use a Japanese acupuncture approach, which is very gentle. But often, over the course of a few treatments, people come to enjoy the experiences that come with acupuncture. So there are certainly patients who come in a little bit anxious about the experience, that almost always goes away after they participate in it. I guess that kind of means that most of the concerns that people have aren't really concerns that they need to have. They're not really based in what the experience is going to be. And so once they see what acupuncture is really like, the concerns tend to go away.
wow, that's reassuring to hear. And even me, I'm a needle phobic, and it it's because just a short story time. It was like when I was grade one, I go to the dentist, and the dentist is his hand is very it's not gentle, so my blood is gushing out of my mouth and I'm crying so bad. And yeah, that give me some trauma to needles.
Oh,
But
yeah.
yeah, that's really reassuring to hear that needles on acupuncture is very different than the one they are using in hospitals. And next topic that I'd like to discuss is hormonal issues are
Well, one
another
other
big
thing I want to
concern.
say about the
Mhm.
needles before we move on,
Oh, sure.
any acupuncturist who has experience can make the acupuncture stronger or weaker depending on what
Mhm.
a person needs. And so, what I'll often tell students is we want to shoot for 80% of what a person can comfortably handle because we don't want to give them 105% of what they can handle. It's kind of a price is right rules, as close as you can get
Yeah.
without going over. And so, if someone comes in and they seem really anxious, then we just adjust the treatment to make it comfortable. And if someone comes in, I had a patient recently who specifically requested strong stimulation on the needles. It's like, great. Then I
Mhm.
will use techniques with them that would make someone like yourself, who's maybe a little more anxious, fly off the table. But we can adjust that. So if people are anxious about acupuncture, just talk to the practitioner you want to work with, mention this, and they should be able to work with you if they're someone worth working with themselves.
That's amazing. So it's really a personalized approach, right?
Yeah,
Wow.
absolutely.
That's really amazing. And another concern that I have is hormonal issues are another big concern for many. Can you explain how acupuncture works to balance hormones? And is it beneficial for conditions like PCOS or menopausal symptoms?
Short answer is yes. The longer answer is that some hormonal issues can be pretty sticky. So when we're talking about something natural like menopause, there's a lot that acupuncture can do. But our primary goal with menopause is not to adjust the hormones, it's to adjust the symptoms of changes in hormones. So if someone's getting menopause early, then our goal might be to stop the menopause and get them to return to a healthy period. I've had multiple patients in their 40s who begin going into menopause early, who, after a handful of treatments, stop going into menopause, which is pretty cool to see. And if they are going through menopause at an appropriate age in a healthy manner, but say they're getting bad night sweats or they're getting insomnia or other similar issues, acupuncture has a ton of tools for dealing with the side effects of all sorts of changes in life, whether hormonal or otherwise. When it comes to pathological hormonal issues like polycystic ovarian syndrome, PCOS, that you mentioned, acupuncture has a lot of tools for this. There are some acupuncturists who work with this directly in terms of hormones, who look at hormone panels and try to balance out the FSH and the LH to regulate a period, and who are working with testosterone and working with estrogen to try to figure out how to straighten those things out. That's not the approach I take. I mostly work with the symptoms and how they're arising and attempt to reverse those things. So when someone comes in with PCOS, and I've had a bunch of patients with PCOS, for me, the goal is primarily to stop the occurrence of the symptoms. So polycystic ovarian syndrome has a handful of hallmarks. One of them is hirsutism. People will tend to grow some hair on their face, as well as, of course, the multiple cysts on the ovaries. They tend to gain weight. They tend to have some insulin regulation issues. I just try to work with all of those symptoms to reverse them. Anytime we hear from Western medicine that something is a syndrome, that word at the end of PCOS, syndrome, that tends to mean that the Western medical world recognizes there's a problem. They may even be able to find pieces of the problem, like a hormonal imbalance, but it means that they don't know why the problem is happening. They don't know what the cause of it
Yeah.
is. And so within the Chinese medicine model, anytime I hear the word syndrome, I kind of step back and want to work with, okay, well, what's your experience of this syndrome? Because people's experiences tend to be very different. Interestingly enough, I find with PCOS that very often we have to work with a lot of old emotional stuff. Some of this can be from trauma associated with very painful periods in teenage years. There can be a lot of different things involved. But often, if we can get some old emotional stagnation to move, regulate their liver chi, and try to move out some of the accumulations, then they kind of stop producing them. And we just use Chinese medicine. I just use Chinese medicine theory for this without really thinking about hormones a whole lot.
Fascinating. That's really good to hear, Dr. Karen. Thank you for sharing that. And could you shed some light on some adjunct therapies you might use alongside
Sure.
acupuncture, such as cupping, moxibustion, or gua sha? What are
Sure.
those?
So, colloquially, in common conversation, what I do is acupuncture, but really, I'm a doctor of Chinese medicine. Acupuncture is just one of the tools we have in our tool chest. So, if I get someone who's really needle phobic coming in, we may not even use needles in their treatment.
Mm.
We can use tools like gua sha and cupping and moxibustion in place of needles. So Cupping helps to pull stagnation out from inside of the body up to the skin. So we can use it, for example, for joints that have mobility issues. We can use it for old injuries to help to release things. Um, this is part of why you see cupping marks on so many athletes, because if they're beginning to get some joint dysfunction, the cupping really helps with this. On an anatomical level, cupping improves circulation and it stretches the fascial plane. The fascia is the connective tissue that surrounds almost everything in our body. And if this tightens up, which can happen due to scarring, this can happen due to overwork injuries, then it can be very hard for mobility to be reproduced, for mobility to return. So cupping is very helpful for getting that to happen. Gua sha, which is not a primary tool that I use, some people use it more, but gua sha involves scraping the skin. This is often done with a Chinese soup spoon, um, and we use this primarily to get heat out of the body. So if someone's coming in and they have a lot of inflammation, if they're coming in and they're getting what we would call signs of heat in the blood, nosebleeds, sometimes heavy periods, sometimes even things like recurring urinary tract infections or recurring inflammatory skin conditions, then we can use gua sha to help get this accumulation of heat out of the body. And we know that there's a lot of internal heat because often even a few short passes with the spoon, the person's skin will turn very red. And after a few treatments, it will stop doing that. And this will usually coincide with the person feeling much calmer, being able to sleep better, being less irritable and agitatable. Moxibustion works on the other side of the equation. We use moxa. Moxa is 2 year minimum 2 year aged mugwort that's had most of its green kind of leafy materials removed and most of its fibrous material preserved. Moxa is used to add heat into the system. So if a person comes to me with too much heat, we'll often use gua sha to get it out. And if the person comes to us with a lack of fire, then we might use moxa to add heat to their system. The main place I use this is in people who are depressed and who have very poor digestion, very weak digestion. They might complain of sluggish digestion, as in things are moving too slowly. They may say that after they eat anything, they get bloated very easily and want to take a nap. When these are the case, we will burn moxa on them to help return heat to the body. We'll often use it for cold. We'll also use it for cold conditions, which can manifest as a painful period. So we can use moxa in place of, say, a hot pack over the uterus or a hot water bottle, both of which are common tools used for painful menstruation. Um, it's got kind of a pleasant smell, and I find it to be very effective, and patients like it. It's often something I'll send home with them so that they can continue doing this on their own at home.
Wow, there's a lot to digest in mind. But it sounds like a comprehensive approach to wellness, Dr. Karen. It's really great.
It's nice to have
And
multiple tools in the tool chest so that no matter
yeah,
what shows up, you can find a way to work with them.
exactly. And lastly, how do you approach the treatment of insomnia or sleep disorders with acupuncture?
Sure. So, when a patient's coming in with insomnia in particular, since I'm in New York, this usually has to do with overthinking and doing too much. In other places, if someone's living in a very relaxed area, then this changes a little bit. But here, we can kind of shorten the issue to they're too up in their head. So often these people benefit from, say, taking a hot bath in the evening, putting down their phone, not checking their work email. And with acupuncture, we use points on the neck and on the legs that descend the chi out of the head. Oftentimes, this means getting rid of knots in the base of the skull or in the shoulders to relax the upper body. And it also means putting points into the ankle and into the lower leg that help to anchor the energy down. Oftentimes, people will describe afterwards that they can feel their feet more, that their mind is quieter, that they feel more grounded. All of these are things which can help people to then relax enough to go to sleep. If, on the other hand, someone is very deficient or anemic, as mentioned earlier, then we may need to increase the amount of blood they have so that their body feels safe enough to relax. And when it comes to sleep disorders like sleepwalking or sleep paralysis, we work with a somewhat more complex system. We see in the Chinese way of thinking about um, how we're made up, we see there being a number of different spirits associated with different organs. So, in a Western conception of kind of a spiritual makeup of the body, we would often talk about a person having a soul. In Chinese medicine, we talk about people as having many different spirits that come together to make them who they are. Some of these spirits, in the Chinese way of thinking, go traveling when we sleep. So if a
Mm.
person gets sleep paralysis, we often see that as some of those spirits not returning. Whereas if someone's sleepwalking or talking in their sleep or similar things, we see that as not all of the spirits leaving. And so we'll work usually with points on the back related to what we call the hun for this. And it's quite effective, usually something that can be resolved in a few treatments, which is pretty cool.
Well, and is it okay if we'll be extending a little more time to
Sure.
sleep paralysis? Because honestly, I've experienced that when I was a kid for 3 years time.
Hmm.
I have it daily. Like I can correct me if I'm wrong. Sleep paralysis is you're awake, you know what's happening on your environment, but you cannot move a single inch of your body. So that's what I've
Yep.
been experiencing for past couple of years. So what my parents did is they go to the hospital with me, and then the doctor doesn't know what to do on those type
Sure.
of treatments. They are telling us that I am having a seizure, even though I know to myself that I don't have any seizure. I can feel everything. I can hear them talking to themselves, explaining what my situation is, but I cannot move. So, what is the root cause of sleep paralysis, Dr. Karen?
So, in the Western medical way of thinking about it, the answer is a little bit of I don't know, and a little
Uh-huh.
bit of when we go to sleep, our brain shuts down our motor function. This is a survival mechanism because if you're having a dream about running, you don't want to run off a cliff in real life, right? So, being paralyzed while you're asleep is a good thing. We don't want to be moving while we're sleeping. But having your consciousness return and still not being able to move is obviously a problem and distressing, as I'm sure you've
Yeah,
experienced. And so, within
exactly.
the Western medical way of thinking, they basically say, well, this circuit in the brain that keeps you from moving didn't turn off. And we don't really know why. And that's about all they have to say about it.
Exactly.
Within the Chinese medicine way of thinking, we see the hun as being comprised of 7 different pieces. And if someone has their consciousness return, often they can move their eyes and nothing else. Um, we see that as being most of the spirits returning, but not all of them. And what we will usually do to start is treat an acupuncture point on the back called Hun Shu, or the outer liver shu, and see what happens from needling that, along with points in the neck to help open up connection between the head and the body. I can send you some information about this later. I
Sure.
find
Yes,
the most
please.
useful treatment in my experience to be what we call bleeding cupping or wet cupping.
Mm-hmm.
This sounds a little dramatic, but it's quite safe and it's almost painless. We use a diabetic lancet, which is made for pricking the fingers of diabetics to check their blood
Yeah.
sugar, and we poke this point on the back usually 2 or 3 times, and then we use a suction cup to pull blood out of the point. Usually a couple treatments of this results in a pretty quick change in the person's sleep paralysis. That's my starting place. In addition to that, we would, of course, look at the pulse and look at the tongue to see if there are other systemic issues going on. But that would be a starting point. So we see it as simply we need to get the Hund to travel better. If it's not traveling well, there's either an obstruction to that happening or there's an insufficiency of resources. Kind of like either the car, if the car isn't getting where you want it to go, it's either because it's running out of gas or it's because there's something it can't cross. And so we begin looking at that and trying to either remove blockages, which would be the bleeding cupping, or we begin adding resources, which would be maybe increasing the liver blood. Depends. That's the basic
Yes.
recipe. And it's usually pretty easy. There are exceptions to that, but it's usually pretty easy.
How I wish I knew you before when I was young. Because honestly, we're really lost at that time when I had sleep paralysis, going back and forth into the hospital, doesn't know what to do. We tried a lot of lab tests just to make sure what's happening to me, but that was way back a few years ago. Especially the technology and the internet is not that famous here in the Philippines. So really lost. Before, I was an active sports player. I was a taekwondo athlete at that time. But since the doctor said that I cannot be exhausted because I will have seizure, so that has been stopped. And because of that, up until now, I haven't even continued doing some sports and everything. So I'm laying low. I'm not very active person. I don't do any hard exercise for myself because of those situations. But yeah, thank you so much for clearing it out, Dr. Karen.
Absolutely. I hope
Really,
that helps
yeah,
some.
it really
Yeah,
helps.
and you and I can talk off the air about some things that maybe we can do to help support.
Sorry.
Thankfully, sleep paralysis is usually not dangerous,
Yeah,
though it is very distressing for people because you can't move, and that's scary.
exactly.
Yeah,
Exactly. Yeah, I thought there was a demon in front of me. Like I
yeah.
can't move an inch of my body, so it's very scary.
Funny you mentioned the demon. Uh, the phrase sleep paralysis in Europe was one of the things that made people think that they were cursed back in the day, that like someone had
Mm,
cast an evil spell on them, because it's very frequent that people, you can Google this and see pictures of it actually. People often thought that there was a demon sitting on their chest, keeping them
yeah,
from moving. This is a common description of what it feels like. And so there must be a witch. There must be something going on. And thankfully, Chinese medicine is a much gentler thought process for this, which is just up an aspect of your what we call the ethereal soul, the part of your soul that travels while you sleep. A part of it didn't come back.
yeah, exactly. I'll look into it, Dr. Karen. I'm really interested with the sleep paralysis stuff. So thank you so much. And it's already
Absolutely.
been 22 minutes. Thank you, Dr. Karen, for another informative session. And also, thank you, listeners, for tuning into Gotham Acupuncture Podcast. We hope today's episode has been helpful. Until then, stay well and be in balance. Goodbye, everyone.
Goodbye, everyone. Thank you, Josh.
Thank you, Dr. Karen. Goodbye.